I've talked plenty of times on how this drives metabolic syndrome and diabetes and obesity. I'm going to just hit a couple neurologic diseases and show you how this happens. So let's look at Alzheimer's. Alzheimer's disease is increasing significantly. It was extraordinarily rare before 1950. It's now like the 7th most common cause of death. In some places, it's increasing even more. It's due to this atrophy of the brain with these amyloid plaques. And it's been a huge mission for pharma to try to develop ways to block Alzheimer's. They made like 20 different drugs to block the plaques. And guess what? It works like crap. It doesn't work at all. Trying to inhibit the amyloid plaques was not really an effective way to prevent Alzheimer's. So people said, hey, we should look at what happens early in Alzheimer's before the brain really shrivels up. Can we actually intervene earlier? And so when they look early, they find 3 phenomena present in the brains of early Alzheimer's. There's insulin resistance, which we know is a fructose effect systemically. There's mitochondrial dysfunction and low ATP. That's also a fructose effect. There's inflammation. That's a fructose effect. Could it be fructose that's involved in Alzheimer's? Well, the risk factors for Alzheimer's are also the risk factors that are associated with metabolic syndrome. Eating high glycemic carbs, eating sugar, a high salt diet, other ultra-processed foods are all associated with this. And in fact, studies like the NHANES have shown that the more sugar you eat, the worse your memory is, both short-term memory and long-term memory. There's a direct link between sugar intake and memory. Not only that, there's a direct link between sugar and how big your brain is. When you eat a lot of sugar, your brain starts to shrink. That's been shown. Not only, and the main area that involves memory, recent memory, which is the most sensitive place that's hit, is called the hippocampus. And the more you drink sugar, soft drinks, it's associated with shrinkage of the hippocampus. That's not good. So there's a link between sugar intake and dementia. If you give fructose to laboratory rats, they have trouble getting through a maze. And it happens within several weeks, and it takes like a month or 2 to recover when you stop the sugar. Sometimes they don't recover at all completely. And not only that, when you look at that hippocampus or other areas of the brain involved in memory and cognition, you can show that fructose induces insulin resistance in the brain, which we know is the earliest finding in Alzheimer's. It induces oxidative stress in the brain, an early feature of Alzheimer's. It reduces mitochondrial production of ATP. That's a fructose-specific effect. We see it with fructose intake, but that's what we see in early Alzheimer's. And in fact, if you keep giving fructose, guess what happens? After about 18 weeks, they develop amyloid plaques. They develop this tau protein. Basically, I can tell you that fructose is likely the cause of Alzheimer's. And we published this recently, and it's, anyway. So here's a very interesting thing. A paper just came out showing that you can block dementia in diabetic animals by blocking fructose metabolism. And so on the top row here, the DB, I should label that DB means diabetes. So a diabetic mouse has high fructose levels in the brain, has a high levels of the transporter for fructose, has a high level of the fructose enzyme that drives the low ATP, and has a low ATP. That is low ATP. They have cognition problems. Now, if you block that, if you inject an antisense to block that fructokinase in the brain, suddenly the animals improve dramatically, and they learn how to go through a water maze, which they couldn't do before. So the diabetic animal takes a long time to get through the maze, but the treated diabetic animal goes back to normal. So you can reverse early dementia by blocking fructose metabolism. And also you can do this trick where on the water maze, you put these little platforms where they have to get to, and if you move a platform, if you the animals are in trouble if they're diabetic and they're developing dementia. They can't find it. But if you reverse that fructose, you can reverse it. They can find the platform. So what about humans? Well, this is a study in humans. Alzheimer's patients have 6-fold higher fructose levels in their brain. They have low ATP. I can tell you that this is the cause of Alzheimer's. Not only that, how do they get it? Well, when you eat sugar, you do get fructose levels going up in the brain. But you know what's the major way to raise fructose in the brain? Carbs, high glycemic carbs, French fries, potatoes, because that makes the brain produce fructose. This is a study in humans from Yale. Within 45 minutes of starting, putting a person, raising their blood glucose, they're making fructose in the brain. And that's a lot of fructose. It's actually the blue line. And that's the increase from 0. That's actually turns out to be a lot.